All right then, good evening everyone. My name is Syra. I'm one of the orthopaedic juniors currently working at the QE in Birmingham. I'm part of the team of Medsuccess, and I've been part of Medsuccess since my second year at university, so quite some time now. Today I'm going to be talking to you guys a little bit about life as a doctor and some of the other opportunities there are to explore outside of medicine, and then we'll have some time for questions at the end. I think we'll just get started. Is that all right, Emily?
Yep, all good.
Perfect. All right. So I'll talk to you a little bit about a typical day in the life as a junior doctor, a bit more about what an on-call shift is like, how training works within the NHS here, and some of the additional opportunities and things like research and academic training as well. So a little bit about me. I graduated from Leicester back in 2018. So I did my foundation training in the area, so my F1 in Leicester and my F2 in Kettering. And now I'm working as a surgical trainee in Birmingham at the QE. Typical day in the life. So for me, my day starts at about 7:45 in the morning with a morning trauma meeting. Most specialties have some sort of handover first thing, and that's how you tend to start your day, going through patients that were admitted overnight, any key issues, and then following on from that, you get on with your ward rounds. So a ward round is essentially a review of a patient that's been admitted into hospital. They're usually led by someone senior, like a consultant or a registrar, but not always. And you look at why the patient was initially admitted into hospital, what their acute issues are at the moment, what's keeping them in hospital, and you come up with a plan for what you're going to do to get them better and get them out of hospital. Once the ward rounds are done, usually it's almost about lunchtime, depending on how quick your consultant is. So then sometimes you actually get your half an hour break. Sometimes if things are a bit busier, it can have a working lunch, writing discharge letters. And then the rest of the day is pretty much spent getting on with the jobs from the ward round and dealing with any sick patients or any other issues that come up. Another big part of our job, especially since COVID, has been talking to relatives over the phone. We don't have relatives coming into the hospital to visit patients anymore, so that in itself could take up a fair bit of time. And then a little bit more about what my life specifically is like as an orthopaedic SHO. So orthopedics, trauma in orthopedics is dealing with patients that have got bony injuries and fractures and things. So like I said, we start our day off with a trauma meeting. We go through admissions from the last 24 hours and any patients that have been referred to the specialty, and it allows for sort of an MDT, a multidisciplinary team meeting, in which many consultants as well as the team of registrars and juniors will be present, will go through the cases, and it often works as a really nice teaching opportunity to look at a case and look at the injuries, and a good opportunity to learn a bit more about a specific condition. Another thing that's quite key as a surgical junior is planning theatre lists. So for us, we have an acute trauma list every single day, and part of our job is looking at the patients that are waiting to have surgery, checking that they are ready to go ahead. So things like, have they got the relevant bloods and the relevant x-rays? Are they ready and fit for surgery for having a general anaesthetic? And are they aware of why they want surgery, and have they consented to it? I also get to spend time during the week in theatre. So now that I'm a bit more of a senior SHO, I get to do some operating myself and can get a bit more involved in things. But as a junior trainee, certainly as a foundation doctor, it was a lot more observational and maybe a bit of suturing at the end. But you get to progress in that aspect of the job as well. And another thing that's unique to TNO, so we also are involved in trauma calls. So I'm working at the QE, which is a major trauma centre, and it means that we get patients who have had traumatic events such as a car accident or stabbings, and they end up coming into us, and it's a whole team that's present when the patient arrives into A&E, and we assess them and get involved in the management of those patients as well. So it's another interesting part of my day. Outside of your normal working days, you have on-call shifts. So these vary between specialties and what's involved. The vast majority of on-call shifts are either working on an admissions unit, so that's where you're seeing patients that have newly presented to the hospital. So you assess them and make a plan to how you're going to manage them, at least for the next 24 hours, and then they'll get a senior review. And the other type of shift that you can have is a ward cover shifts. So these are shifts where you're covering multiple of the patients that are admitted onto the wards, and you're basically there to deal with any sick patients and sort of manage any acute issues that can't wait for when the team will be back on the next day or on Monday for the weekends. So like I said, these shifts are out of hours, so your evenings, your nights, and your weekends, you typically have less supervision and you're often responsible for more patients. So there's more challenges involved, but they're also a very good learning opportunity. And your on-calls end up being what shapes you as a doctor, the things that you see in your experience. And typically here, certainly for me at the moment, on my on-call shifts, I carry a bleep, as is the case for most people in the country. And it means that that's how the nurses can communicate with you. So they'll bleep you and let you know if there's an issue, if there's something that they want you to come and see or to do, and that's how they stay in contact with you. So I've got an example of a sort of a job list from an on-call shift, a few different jobs that have came up. I'll give you guys a few seconds to just read through and have a think of how you would prioritize these jobs. This is just to give you a sort of a flavour for the kind of job that you end up doing from sort of day one as a junior doctor. Okay, so I will share how I would prioritize these things. So your top priority in any situation is a patient who's unwell. You do an assessment, you make some initial plans and you try and get them stabilized. So that would be your number one priority. Paracetamol I've put second. It's obviously if you've got someone in pain, you don't want to leave them in pain for very long. And another thing to think about when you're prioritizing jobs is the amount of time that it takes, as well as how important the job is. So a paracetamol prescription will take a minute or so of your time, but will have a big impact on the patient and the nurse that's being bothered by the patient. Reviewing an x-ray, so it depends on what the x-ray is for and why it was done. But any investigations that you request for, as a doctor, it's your responsibility to make sure that those results are looked at. As I mentioned before, speaking to relatives is a big part of your day job on the wards as a junior doctor, especially without relatives coming into the hospital to see their relatives. Making time to make phone calls is something that has changed since the COVID pandemic has happened. So taking time to call them and update them. And then finally, discharge letters. So discharge letters are another thing that take up a fair bit of time on the wards as a junior doctor. It's good to try and get things prepared in advance, as it means that when a patient's ready to go home on the day, things are tidied up. So preparing discharge letters is something that's convenient to do as well, but less important than your unwell patients. So the good, the bad and the ugly. I think that medicine is a very rewarding career. You can really have a big impact on someone's life and make a difference to their quality of life, and getting to be there in their tough times and support them through it is a real privilege. I'm interested in orthopedics, so we fix bones, and I think it's very satisfying to get to see someone that's come in with a broken bone for whatever reason and put that bone back into place and get them walking again if it's a sort of a hip fracture. You also meet some really wonderful people. It's a very social job. You're constantly speaking to patients, to other colleagues, and it's a very nice way to. It's very nice if that's something that you enjoy doing. sort of the downsides of the job. It requires a lot of commitment. As you guys are all going through the application just for medical school, you'll see that in itself is tough, and the rest of your career is still posed with plenty of challenges. Typically, junior doctors don't end up leaving on time. You may often find that you're leaving work a little bit later or having to stay extra, working through breaks. It's not uncommon, unfortunately, and it can be very busy, the day job. It can be quite tiring. So having resilience and having a good support network is very important, and also having a good motivation for why you want to do the job, especially at times when you're dealing with difficult patients or overworked colleagues who aren't always as appreciative of the efforts that you make. But overall, I wouldn't change my decision to be a doctor, and I love my job. So talking a little bit about the structure of training. So once you've done your 5 or 6 years of medical school, you start off in your foundation years. So you have 2 years and you do a mixture of rotations. They're there to give you a flavour of different specialties within medicine, and you have some choice in the sorts of jobs that you can do. A lot of it is much more ward-based, because that's sort of the basics of being a doctor, is managing a sick patient and managing acute patients on the ward. Once you've done your foundation years, you then move on to your core training. So this is 2 to 3 years, and at this point you start to think about what sort of specialty you want to do. So broadly, there's medicine and there's surgical training, psychiatry, GP training, pediatrics, obs and gynae, and then there's also the acute ACCS, which is sort of your acute care, and that incorporates emergency medicine, intensive care and anaesthetics, and acute medicine. So you kind of make that decision at that point, and then from there you end up going on to specialty training in your specific field, and that can take up to 4 to 6 years, sometimes a bit longer, and with the exception of GP, which is just those 3 years as a trainee. And after that, you become a consultant or a GP in the specialty of your choosing. There's also an academic pathway. So as a medical student, you have the options to intercalate and do either a BSc or a master's. I think there are some places that even offer a PhD. Once you graduate, there's also an academic foundation year program that runs alongside the normal foundation program. As part of that, there's opportunities to do sort of management posts, posts that are related to teaching, as well as posts related to research. And then again, at the specialty training level, there's also academic clinical fellowships and academic training posts that give you allocated time to do research and to do teaching and to take on other opportunities. And then as a consultant, you can take on things like being a lecturer or doing senior clinical fellowships, and further specialising within the department that you're interested in. So there's a lot that you can do within medicine. There's a huge variety, and there's a lot that you can do to make your career unique to you. Some of the other opportunities, so I talked about doing a BSc as a medical student, and there's a huge variety of different degrees that you can do. There's some that are more research based. You have things like medical law as well. There's a whole host of things that you can do. There's opportunities for fellowships. So nowadays it's becoming quite common for people to take a year out after their foundation training, and there's opportunities to become a clinical fellow at that point, to try and spend a bit more time in a specialty that you're considering but want to learn a bit more about. And at all levels, doctors are involved in what we call quality improvement projects or audits, and it's on not as large a scale as your other forms of research, but they're projects that look at how things are currently working in the NHS and how we can improve our services or our facilities in order to improve the care that we give our patients. Outside of research, there's also teaching opportunities. So I mentioned having an F3 year. A few of my friends have done clinical teaching fellowships as part of their F3 year, and they've gotten involved with teaching at the medical schools. And as a senior registrar and consultant, you can get involved in training your junior colleagues, and being clinical supervisors for them as well. to sort of summarize, I think if you're doing medicine for the right reasons, you will get there. It's tough, but it's worthwhile and rewarding if you put in the hard work and you're willing to. And like I said, there's a lot of ways that you can make your career unique to you. So there's the research opportunities, teaching, quality improvement, and outside of that, there's a whole host of things. So I've met colleagues who have travelled abroad and work with, more rural countries and third world countries to deliver services there and support the development and healthcare in those countries. So it really is what you make of it, this job and this career. And that's it. Thank you all very much for your time. If you've got any questions, feel free to either turn off your mics or you could pop them in the chat as well. And I think there's a feedback form as well that we will send out in the chat.
So there's a question.
Mm-hmm.
What if you studied medicine at first and then thought it wasn't quite for you?
Okay, so I think I don't think there's anything wrong in choosing to do medicine and then changing your mind, or going back and choosing to do medicine later on. I think especially at 17, 18, when you're leaving school, there's a lot to think about and it's a big decision to make, but I don't think anyone would think any differently of you if you started medical school and changed your mind.
Now, got a few questions for you, Sarah. I'll just read through them one by one. Is ortho the only specialty that does trauma, or do other specialties like cardio do that too?
So ortho is known as trauma and orthopedics. So in most centres, a lot of the trauma will be managed by orthopedics, at least at the initial stage. But it depends. So there are other surgical specialties that will get involved as well. There's less so from a medical point of view. It's usually surgical issues that get managed, and anything else is typically patients that come in with traumatic injuries end up under orthopedics. Other specialties that get involved are obviously the emergency department when the patients first present, and then your ITU doctors. So if patients have had a lot of trauma, then they'll end up on intensive care. And here at the QE, we've got an ITU that is almost specifically for our trauma patients. But yeah, I think it's less of medics are less involved with trauma.
Next one. So after you graduate, you become a junior doctor? Question mark.
So a junior doctor is a very generic term, and it encompasses a whole host of people. So yes, you are a junior doctor, but your junior doctor is a term that encompasses your foundation doctors, who are sort of the first year working, all the way up to registrars can be included in that, and some of them have been working for 10, 15 years. So anyone that isn't a consultant or a fully qualified GP is counted as a junior doctor.
What made you decide to become a doctor?
So my dad is a doctor, actually. So I was exposed to medicine from quite a young age. He loved his job and instilled that into me. I knew I wanted to do a career that made an impact on other people's lives. And I think with medicine, you can really do that. It's very rewarding. I like a challenge. So I don't mind that there are times where I'm pushed. I also like that it's a career where you're constantly learning and constantly improving and training, and it's not sort of a job that stays as is. It's constantly evolving.
Do you complete foundation years in the area near your university, or can you move back home and complete foundation years in a hospital close to your home?
So the foundation programme is a national programme So when you're in your final year, you apply and you rank jobs, and you get ranked yourself based on your performance in sort of your medical school exams, as well as an SJT exam, which is sort of similar to the one that you sit as part of your UK CAT. So you get ranked, you rank the areas, and depending on that, you get allocated jobs. So you can move to pretty much anywhere in the country, anywhere in the UK with your foundation jobs.
How would you deal if an unexpected situation occurs while on the ward round or doing ward round jobs?
So one of the things that I really like about medicine is there's a lot of systems in place. So when you're dealing with a sick patient, you have what we call an A2E approach, which is an acute assessment of the patient, that you start off with the things that are going to kill them first. And you essentially do a top to toe assessment that allows you to identify the acute issues. And then for those acute issues, there's acute things that you can do. I think being able to stay calm under pressure is a real key skill that does take some time to pick up, and as you get more experienced, it gets easier. But I think what I like about acute situations is that you stick to your basics, and you escalate to your seniors if you've got any concerns. And there's a whole host of people. It's not just doctors, it's not just your other doctor colleagues. Nursing staff are a really valuable resource as well as your physiotherapists, your pharmacists. There's a lot of people that are willing to help. So there's definitely help if you need it.
Is a medicine career right for you if you don't want to be studying all your life?
So it depends on the sort of specialty that you do. I think to an extent, most specialties you are doing some sort of you're having to keep up to date with guidelines and changes, because that's constantly changing. But there are some specialties that will demand a lot more of you in terms of the studying and the teaching that you're doing as compared to others. So yes, you are studying, but it's not necessarily intense revision for exams. It's more keeping up to date with the new changes within medicine and changes to how we manage conditions that we already know about.
How stressful would you say it is to be a doctor?
It can be quite stressful at times, but I found that with, like I said before about sticking to your basics, so there's a lot of useful tips that you pick up on as you go through your training to sort of manage and structure your approach to certain things, and you use the people around you, so you work as a team with your colleagues and with the other staff and other healthcare professionals. And I think even the most stressful days, with the right team, you get through it, and you come out of it having learned a lot and become a better doctor as a result of it.
What was the most challenging thing that you've faced so far?
That's a good one. So this time last year, I was working as part of the major trauma service at the QE. So I was dealing with patients that came in as a trauma call, and that was our job pretty much. We just dealt with all the trauma calls. And there was one night where there was a man that had gone round in the city centre and had stabbed loads of people. So we had about 5 or 6 patients that come in very close together, all in about an hour and a half. And some of them were very unwell. Others of them were a bit more stable, and it was very chaotic as well. There were loads of people around in the emergency department trying to help, but it was a very challenging situation to be a part of. But actually, I had a really good team, and we ensured that we communicated well with each other. We kept on top of what was going on, who was the sickest patient, who went where, because a few of the patients went straight to theatre. And actually afterwards we all sat and had some tea and had a debrief once things had settled down, and talked through what things went well, how we could improve if we're in that position in the future, and we reflected on the whole experience. So it was a challenge, but it was one that I learned a lot from.
What made you choose medicine rather than nursing or one of the other allied healthcare careers?
So for me, medicine was about, the reason I wanted to be a doctor specifically was I wanted to not just be able to be there to support someone through their sick times, but to understand their illness and to be able to implement change and to, you know, make decisions regarding their management that would lead to them getting better. So I think that was the main reason I wanted to be a doctor. All right. If I think that's everything then. Thank you all for joining us today. If you guys could please fill in the feedback form, I think Emily's posted the link. So fill that in for us, it will be really useful, and we hope to see you in our session next week.